Dr. Emilie Sebesta cares for children of all ages, but has a special interest in newborns and helping mothers to successfully breastfeed. After helping to create a room for staff, students, and faculty to express breast milk for the newborns as a young attending, she was asked to participate in education around breastfeeding for residents and students, including helping to create teaching modules used by the American Academy of Pediatrics. She became active in the New Mexico Breastfeeding Task Force and helped lead a $1.5 million effort funded by the W.K. Kellogg Foundation to increase the number of baby-friendly hospitals and birthing centers in New Mexico, including at UNM, which was designated baby-friendly in 2014 and redesignated in 2019. She has been the pediatric medical director of the UNMH Mother Baby Unit since 2010 and continues to love caring for newborns and their families, calling the Mother Baby Unit her happy place. With that, Dr. Sebesta, please take it away.
Okay, computers are not my friend. All right. So I'm going to kind of just blast through the, you know what we're talking about. We're talking about cannabis and breastfeeding. So basically, we're going to talk a little bit about cannabis and being pregnant, as well as breastfeeding, some potential side effects, and then what our current recommendations are. I'm going to go a little bit fast because I know we're behind time, and I'm so sorry. No financial disclosures. I wish I had some, but I don't. So, one thing that's interesting in the last few years that it's very nice. I mean, now the United Nations, the World Health Organization, UNICEF, and the Academy of Breastfeeding Medicine have all recognized breastfeeding as a human rights issue, and it really makes me happy that we are talking about it that way because, it's not just fluff. It's important. So marijuana use during pregnancy and while breastfeeding, I'm sure you all know, has increased tremendously. Right now on the unit, I have 2 moms using marijuana while breastfeeding. So this is just very, very common now. So it's gone up a lot, somewhere between 4% and 16%. It's hard to get an exact number. In younger people, the estimated rate is as high as 43%. So you will see it a lot. And so lots of states are also showing an increased use in the postpartum period, not just during pregnancy. And so this is just an example of Colorado. So prior to pregnancy, 17%, it drops a little bit, and then it actually goes back up after they deliver. So that's kind of interesting. And marijuana, of course, is, illegal in most states now, at least medicinally. So certainly it is here. Is that going to work? No. All right. So one thing to know is that the majority of moms who are using marijuana are doing so for perceived health benefits. So prior to pregnancy, they may be doing it more for recreational use, but once they become pregnant, they're primarily using it for health reasons. Like, for instance, one of the moms this week, she uses it for anxiety and depression even before pregnancy, and then also for nausea during her pregnancy. And so there's this perceived this idea that it's going to help with nausea and vomiting and increasing appetite. And if patients have bad nausea or vomiting, they're 4 times more likely to use it. A lot of people believe that it reduces their anxiety and depression and decreases pain. There really aren't good studies to show that these are actually true effects, but this is what many in our population are believing to be true, and feel like it is helping them. So, this was a really nice study from 2025 looking at almost 500 moms over the entire country about, whether or not they used marijuana during pregnancy or prior to that. And as you can see, most of these moms were doing it for fun before. And then again, during pregnancy, they begin using it more for perceived medicinal purposes, or at least that's what they're telling their doctors and the researchers. And you can see that. So helping with mood is number 1, decreasing nausea is number 2, relieving pain, reducing stress. All right. So another thing that's a little distressing, and I'm seeing this across the board, not just with marijuana, but people aren't looking to us being medical providers for their information. They're primarily talking to their friends and family and online resources. And this is happening in many realms. Today is the 4th day in a row I've had a family refuse vitamin K. And most of the parents report that they did their own research, and they saw lots of scary things online. So people are more and more feeling like they can get what they need from the internet, which is, in my mind, very frightening. This is one area where I believe artificial intelligence actually might help us instead of hurt us, because if people start using artificial intelligence, they're maybe going to get better information, but maybe not. So this same study, or no, I'm sorry, this was an earlier study looking around the same, I think it was the same group of moms though, the 484. So only less than half knew marijuana passed into breast milk. So there is an area where we can do some education with parents. About a third knew that using marijuana during pregnancy increased the risk of SIDS. About half knew it increased the risk of preterm birth and low birth weight. And over half knew that it could increase their child's risk of learning problems. And also, again, about half are aware that it can increase the risk of childhood behavioral problems. So people are more aware than they were when I gave talks about this like 10 years ago, but there's still a lot that they don't know. And especially it's a little disturbing that they don't know that a lot of moms don't know that it passes into the breast milk. So the Infant Risk Center, I'm sure you all are aware of Thomas Hale. He's one of the most knowledgeable people in our country on breastfeeding and medications or breastfeeding and any substances. So he had done an anonymous survey, and a little older, 2018 to 2019, but a lot of responses. And 2/3 of the moms were not worried about the effect of marijuana on their babies with breastfeeding. Again, half were using for medical purposes, half were using daily. And the vast majority thought it was safer than medications. So again, this is another area for education, right? So, these moms are feeling like it's safer than taking Zofran, for instance, or, a proton, or like a, Zantac or something. Almost half were timing their use in order to try to avoid possible side effects, which is interesting because with marijuana, that's not going to be very effective because it has such a long half-life. So trying to time use with breastfeeding is not going to be helpful. Not like with alcohol, where basically whatever your blood alcohol level is going to be what's in the milk. And so if you wait until you don't have any blood alcohol in your body, 2, 3, 4 hours later, it'll be safe to breastfeed. That's not the case with marijuana. And then 3% thought use affected their baby. So interestingly, some thought it actually helped them sleep more, helped them be calmer, thought they were more advanced. And then some thought it was delayed, but a very tiny majority thought that it had any effect on their babies at all. So this is interesting because it actually it turns out that cannabis, as cannabis has become legal, we're seeing more and more research, which is wonderful. I think in the next 10, 15 years, we're going to just have a whole lot more information about what cannabis does, because it was really difficult to study when it was illegal everywhere. So this was just a little pilot study. And they looked at 22 moms who were using cannabis and 18 who were not. And they found that the people who were using cannabis actually had less secretory IgA and more lactose. And so that's potentially concerning, because secretory IgA is really important, right? And so you can see the bottom box, that's the secretory IgA. So the levels were lower in cannabis users. So potentially it could actually be affecting how good the breast milk is for the baby. Now, I think we all would still argue that breast milk is better for the baby, even if the mom is using marijuana, but it is disturbing to think that the breast milk might decrease some of the good things with breast milk. So same study, and they also were reporting that they had lower milk production in the first 6 weeks postpartum. So same group of the 22 users and the 18 non-users. So potentially lowering their baseline plasma prolactin and consequently lowering how much milk they made, which is also very concerning. So there aren't any studies. So like when we are looking at the effects of children long term, there are no studies that examine the outcomes of exposure to marijuana via breast milk alone, right? So virtually all of our parents, birthing parents, breastfeeding parents who use marijuana while breastfeeding used while they were pregnant. So it's incredibly difficult to tease out what effects are from the exposure in utero and what effects are from using while breastfeeding. So, what is the evidence? So we know that it can negatively affect brain development, and we know it can increase the risk of lower birth weight. Um, you know, it changes the circulation of the placenta. We know it changes, and I think this next slide might do a better job, but we know it actually changes the structure of the brain. So for instance, there was one good study, and I don't think I quoted in here, that actually looked at like MRIs of babies' brains, and there were actual physical differences seen in the babies of brains whose moms had used marijuana throughout pregnancy versus moms who had not. And we know that the endocannabinoid system is really important in brain development. So it's very important in laying down the neural networks and perhaps more importantly in pruning those networks. So, you don't want to just have, I think you're all aware that as the brain is formed and neurons lay down these pathways, then they have to prune some of them back so we're not just getting bombarded with too much information. And it affects that process, which is probably why it has been shown to have this effect neurodevelopmentally on children over the lifetime. So as you can see, they're more likely to be small. They're more likely to have, they actually, if you've ever seen a baby withdrawing from opiates, babies whose moms used marijuana during pregnancy may also show similar signs. They may not, but they may also show similar signs. Three really good studies, longitudinal, very large populations, mixed populations, so not just all white people, not just all American, and not just one socioeconomic. So just a really good distribution of participants and showing, decreased memory, decreased verbal scores, increased aggression, ADHD, difficulties with attention, and overall, eventually, increased rates of marijuana use and tobacco use. And again, in these cases, they were controlling for what the kids were exposed to. So it's not just, oh, your mom uses marijuana, your dad uses it, so therefore you use it. These were independent of that. So not, not the greatest thing to expose your child to. But again, this is in utero. So this one is looking at like this. I mean, I'm not going to go through this because that's a lot of detail, but just to say that they've now been able to really hone in and say, this is exactly what the effect is on, these genes in pregnancy or, in the baby and what the long-term outcomes are. So, the effects on this type of messenger RNA is what can lead to this. And, this type is what leads to the executive function and the hippocampus and the striatum. So we're getting more detailed in understanding why this is happening, not just that it is happening. So marijuana use during pregnancy. This is another small observational study of 71 really high potency. So people who were using pretty high potency and weren't using tobacco or alcohol. And this was a meta-analysis of almost another one, almost 8 million pregnant women. And they found that the risk of preterm birth, low birth weight, decreased size of their head, NICU admission, and sudden unexpected death in the first year of life. Well, so I take it back. So the first one up here, let me say, this shows that, so this very small study with the high potency users did show, yes, they weigh less. Yes, they're shorter. Yes, their head circumferences are smaller. And then another meta-analysis also showed those things, but didn't do as good a job for controlling for variables. But again, good reason to believe these effects are true. We already talked a little bit about this, the marijuana withdrawal, the kids looking basically like they have neonatal opioid withdrawal syndrome, increased startle, tremors, high-pitched cry, abnormal sleep patterns, and things that make them not be great breastfeeders for that matter. So these very old studies, I'm sure you've all heard of the one study from 1990 showing possibly a resulting motor delay at 1 year of life, but other ones didn't find that. And this is about it. And then LactMed talks about how the effect on prolactin is variable, but they does tend to show that they breastfeed for shorter duration, but not a lot of studies specifically looking at marijuana and breastfeeding versus marijuana during pregnancy. So THC is really lipophilic. In other words, it loves fat, and babies' brains are fat, basically, and so is breast milk. So the milk to plasma ratio, for the longest time, we just had this one report of an 8-to-1 ratio. But since then, there have been several studies showing that, yes, the milk to plasma ratio is quite high, somewhere between 6-to-1 and 8-to-1, consistently through different studies in different women. The estimated half-life is 17 days, and elimination up to 6 weeks. But there's really low systemic bioavailability. So we don't think, despite the fact that it's concentrating in the milk and is going to hang out for a long time, we don't think that the babies are actually going to end up getting a lot of that, because there just isn't a lot of bioavailability. And I don't know how many of you out there have been around long enough, but when I first started 25 years ago, we routinely told moms that if they were breastfeeding, if they used marijuana, that we just flat out said, don't breastfeed, right? So that was what the recommendation was for many, many years. And then I would say and then there was a long period where we said, okay, if you don't use heavily, we're going to say it's okay. But then we would still tell people, hey, if you're using every day, we're going to recommend against breastfeeding, and we're going to recommend that you do formula instead. And then it's really just been in this last maybe 5 to 10 years that we've realized, no, things like this showing the low systemic bioavailability, as well as kind of recognizing more autonomy in patients, that probably the effects of breastfeeding, the good effects are going to outweigh the potential bad effects. And I really loved, Hale's study showing this low systemic bioavailability. So it's been really a huge shift in what we're doing, from saying no to saying yes, but not if, to now saying yes, but we really encourage you to reduce use. And another thought about why we are telling people to, reduce use is, babies' brains keep growing really rapidly after they're born. So it's not like, oh, the minute you come out, we don't need to worry anymore. And so this is just an example of newborn baby, and 90 days later, huge growth, lots of changes to the brain happening in that time. So everybody recommends that we counsel against using marijuana while pregnant or breastfeeding. That's universal. I don't think there's any disagreement from any of the major health organizations throughout the world on that front. I liked 2025 ACOG consensus, and this makes me very happy, because they really say healthcare providers should be educating all individuals, not just asking, do you use marijuana, and then providing education to that group, kind of like we do with alcohol, right? Like everybody is counseled against using alcohol while pregnant. We don't just say to somebody, hey, did you ever drink? Oh, okay, now we're going to talk to you about how you shouldn't drink during pregnancy. So shifting that focus from screening and then educating to saying, no, we need to educate everybody, that there really aren't, any medical indications for use. We should be doing quote unquote universal screening by interview. Very much we're against biologic testing. We're still struggling with that at our institution. We really don't test unless there's an absolute need to test, like we believe, for instance, that a baby's withdrawing, and the mom wasn't willing to give a sample, and the mom says she wants to breastfeed. But very, very individual circumstances, there's a lot of disagreement between what we'll do and what the intensive care unit will do. But as a rule, throughout the country, people are moving away from using biologic testing, urine drug screening. And of course, if the parent says they are using, cannabis, we really should be advising that they stop. And it was nice to have them come out and say this, because there certainly were, a lot of providers in the community who were suggesting, hey, this is natural, this is good, this is a fine way to treat your nausea. And so it was nice to have ACOG come out and say, no, there's no good evidence, and we really would prefer that you not do this. But finally, bottom line, it's not a contraindication to breastfeeding. And we should not be discouraging breastfeeding. And I know when I gave this talk a few months ago to providers throughout the state, a lot of them said that in their hospitals, providers were still saying that. They were still telling moms if they used marijuana that they should not breastfeed. And no health organization recommends that now. So if you're encountering providers who say that, please direct them to the AAP, ACOG, any of the major health organizations. Everybody's in agreement that we still want to encourage breastfeeding, and it is not a contraindication. So, one of the things we do, I think, is we don't talk about it enough, right? So there've been several studies, and one of these here, the 2023 group, they did focus groups, and basically they found that participants wanted to talk about the cannabis use with their providers. They wanted to hear what the providers had to say about use or not use, and what was going on. And they felt that if a provider didn't talk to them about it, they were essentially saying it was okay. Of course, they also very much want that you give the information, but don't be judgmental, and don't, obviously nobody wants to be judged. But the participants as a whole very much said, no, I want to hear the information. I want you to give me that information. And I don't know about the rest of you, but I find that if I sit down with a parent and take the time to go through what the evidence shows and what the evidence doesn't show, I think that's important as well, to talk about the things that we don't know. People really appreciate it, and I think that they're more likely to make decisions in the best interest of their child, because nobody really is trying to make decisions that are bad for their children. And so, we need to become more comfortable with having these conversations. And then again, we need to be open about the fact that, yeah, the evidence very much shows that it's not great for brain development. And when we're talking about like breastfeeding, we also need to be very clear that we don't have a ton of information about effects from breastfeeding and marijuana alone, but that based on the whole picture, that it stores in the fat, which is what milk's made of, it has a long half-life, we know it affects brain development in utero, that everything suggests that it'd be better if you didn't use, or if you reduced use. So this was interesting. A 2024 study in Virginia found that a third of providers that were caring for pregnant and postpartum women were unaware of the impact of cannabis use on the health of the mom and the infant. And that's truly horrifying, because that's only 2 years ago. So yay for us talking about this and trying to get the information out. In another study, this was about 500 women, 15 different hospitals. Less than a third of the participants said they received any counseling at all, either prenatally or postnatally, about the risk of using marijuana. And of course, I shouldn't say of course, not unsurprisingly, Black, young, and low-income moms were more likely to report that they received counseling. So, I would say this is one of the take-home messages, that we need to really do a better job about providing counseling to everybody, and to doing so in a non-judgmental way, and without what's the word? Well, not just bias, but yeah, we shouldn't be making assumptions based on somebody's race or age or socioeconomic status. So again, the young Black low-income moms were more likely to receive that. They also were more likely to undergo drug testing, and they were more likely to be reported to Child Protective Services. And then PRAM's data showed that non-Hispanic Black people were 4 more times likely to be advised against breastfeeding if using cannabis. So this is probably not surprising to any of us. I think we've just learned and been shown over and over again that no matter how good we think we are, we continue to not do as good a job as we need to be doing, and we need to do better. And I say we because I think, I think most of us probably have biases that we're not even aware of. So here at UNM, if a mom reports use of marijuana, or if she had a positive drug screen for marijuana, and we don't test for marijuana at all anymore in this institution, but sometimes that come from an outside institution and may have a positive test. The first thing we're going to do is try to figure out why they're using and talk to them specifically. And if, of course, they're using it for therapeutic reasons, to talk about the other potential therapies, and to make sure that they're aware that from at least our standpoint, the evidence is not there to support use. And frankly, screening and counseling have been shown to be really effective. So in the AAP 2018, they talked about that when providers take the time to counsel women. I say women because most of our breastfeeding parents are going to identify as women, but I should say when they talk to the birthing parent or to the parent who's breastfeeding, um, people listen. They may not seek out our help first, right? They may go to the internet or their friends, but when we take the time to provide them information, they often listen. Um, and so we need to do that. So I just always include this quote because I love it. Educating and counseling lactating mothers in a supportive and non-judgmental manner regarding the goal of abstaining from marijuana consumption based on the potential risks of marijuana use during lactation are key roles of the healthcare provider. So this is our job, whether we like it or not. Um, and for lactating mothers who choose to continue using marijuana, our job is to provide lactation support and advise them to minimize their consumption. So we engage in shared decision making at our institution. We encourage commit to sit for all of our patients, but I think especially when you're talking about substance use or any kind of more sensitive topic, it's really imperative to sit down and have a face-to-face conversation and not look like you're in a hurry and not look like you're standing over the patient and lecturing. Um, and really share again the information that we have and that we don't have so that the families can make the best decision for them, right? I may believe that the best decision is to breastfeed, but a mother may decide for his or her own reasons that it's not, and our job is to supply that information. So these are some handouts that we have at our institution concerning marijuana use during pregnancy and then afterwards, which I think are very good. Colorado has really good handouts. I mean, there's good handouts everywhere now. There's no shortage of really good information available for parents. Um, these are some talking points that we include in our policy on this. And so, some talking points, obviously, babies' brains continue to grow. THC concentrates in fatty substances, which is basically brains and milk. The fact that the milk to serum ratio may be quite high. And that also, which we haven't touched on before, is that most of the studies that have looked at the use of cannabis in pregnancy were done when cannabis was a lot less potent. So it's kind of a moving target. I mean, the from my understanding, the potency now is probably 10, 20 times what it was, back in the 70s or 80s well, okay, I'm aging myself. When I came of age, but certainly in the last 10, 20 years, things, marijuana has gotten very strong. We don't know how much it's going to get. Again, bioavailability is probably pretty low, but it does appear that it's going to affect maternal levels of prolactin and oxytocin. So it might actually affect their milk supply. And for the moms who are kind of deeming marijuana to be kind of really natural and potentially helpful. I think this may be something that's a useful thing to talk about with them, that this could have an effect that they really don't want of reducing their supply. And then of course there's lots and lots of research going on all the time. And so we've really got to just stay abreast of the research and let families know that, hey, this is what we're recommending right now, but this could change because we're learning more every day. That's breastfeeding and HIV. That's not really part of our talk today. I can talk about it if you want. But I suspect that from a time standpoint, we should probably be done. Mario, are you the one leading this?
Yes. Do you want to go ahead and open it up to questions for?
Yeah, let's open it up to questions.
Okay. All right. If you'll have any questions, please feel free to unmute yourself and go ahead and ask, or drop them in the chat. We'll read them.
I do feel like people are getting more comfortable with this topic, although I think there's still a lot of times where we just ignore the topic and we just don't have that conversation with the parent. And so I think it's important that we do that. And while we're waiting for questions, I guess everybody is probably aware now that HIV is no longer on the contraindication list if the mother was treated during pregnancy, has a undetectable viral load, and is committed to continuing her treatment and the treatment for the baby, which is really good news, in my opinion.
Definitely.
I do have a question.
Yes.
When any of the medical providers are working with moms who are pregnant or have had a child and they're testing positive for marijuana or admitting it, do you guys
Mhm.
report it to Kara at the time that they're pregnant or when the baby's born, or how does that come about?
So I don't take care of people prenatally, so I can't speak to referrals to care during pregnancy, and so maybe somebody else can respond to that. We unfortunately have to ask, offer a care plan to every single parent who admits even to alcohol early in the pregnancy. And so I don't know, it almost feels like everybody's being offered a care plan these days. But yes, even if it's like say they use marijuana early in pregnancy and then quit, our social worker is going to go meet with them. We're lucky at UNM that we have an excellent social worker who's worked for CYFD and is very just very, very good at her job. And I think approaches us in a manner that makes the patients not feel threatened. But yeah, by law, we absolutely have to regardless.
Dr. Sebesta, this is Dr. Elvis here down in Las Cruces. I have a follow-up question regarding that. Can you hear me?
Oh yeah, I can hear you just fine. Thank you.
Great. So at our institution down here at Memorial Medical Center, we consult social work to develop a CARA, plan of safe care, as you mentioned, for all moms who have used marijuana during breastfeeding. But we do not consult CYFD for those moms. If marijuana
That's right.
Substance, is that what you do as well up
Yeah.
there?
Yeah, that's exactly right. So you offer a care plan, and there was a period there where if they said no to the care plan, you had to refer to CIFD, but apparently that has changed. And so if the parent says no, you don't have to refer to CIFD. So we refer to CIFD if we have concerns about the safety of the child. And I don't think I've ever had a family where marijuana was the only thing being used that we made a CYFD referral. But I mean, clearly you could have true and unrelated, right? You could have an unsafe house with concerns that have nothing to do with it, but the marijuana alone is absolutely not an indication for a CYFD report.
Thank you so much. I appreciate it.
All right. In the interest of time, the last question will go to Chris Barch.
It's not really a question. It's more of a comment going along with what was being spoken about. So when providers are entering that plan of safe care into the portal, it is serving as a notification to CYFD, but in a notification capacity only. It is not a report of abuse or neglect. And so keep putting those plans of safe care in your system, and we will be bringing you a new system sometime next year that's going to be a lot more helpful for everybody. Yeah. Thank you.
Let me see. When a person asks how long they should abstain in order to become clear of cannabis in their bloodstream, what should we recommend? Well, that's a tough one. I mean, the half-life is almost 3 weeks, and the time to clear completely is a couple of months. So I think it's really just that's not a reasonable expectation to abstain in long enough to become clear of cannabis. I would just say that the overwhelming data at this time is that the breast milk, if you're telling me you're going to choose formula over breast milk with some marijuana in it or THC in it, the breast milk is better. But it's going to take, 20, 20 days to 2 months to fully clear. So I would not encourage anybody to abstain for that long. Or I should say, I would encourage them to abstain. I would not encourage them to discontinue breastfeeding while they're waiting for it to clear.
All right. So with that, go ahead and close out today's session. Thank you very much, Dr. Sebesta, for that great presentation. And thank you all for your patience today, and have a great rest of your day.